Hi, I'm Bob Schrupp, physical therapist.
Brad Heineck, physical
And
therapist.
together we are the most famous physical therapists on the internet.
In our opinion, of course.
And today we're going to talk about the ice massage, and obviously we're not going to use this one now that I've licked it, but it's good.
Yeah.
It's kind of good. All right,
Don't show your kids that, Bob.
Now, this is a very simple massage, and it's just so helpful, especially for the person who's in a hurry.
Right.
Did you say, Brad?
Oh, you bet.
Why don't we do it on your forearm?
Sure. Okay.
What kind of light? It's like a tennis elbow?
Right. So we're going to use a nice massager if you got a sore spot that's just been injured.
Right.
Right.
And you want to calm it down. You want to
Sure.
calm the inflammation down. And the thing is, this is easy and fast. You can
Right.
do this what you're going to do is take a. By the way, Brad doesn't like styrofoam cups. He likes paper cups.
It's a personal preference. They just seem so nice when you rip them off. These kind of break. And
See what Brad's doing. Why don't you show this camera right here, Brad?
but these do insulate.
And I go like this because there's rough edges on here.
Right.
And I just work it down till it's nice and smooth.
Yeah. Yeah. Because you don't want those little edges.
Right.
Digging into your
So
skin.
now it's nice and smooth. I know there's so many cameras here now. I don't know where to even show, Brad. See that? Nice and smooth. All right.
Now, let's say the injury I have is tennis elbow. Right here, it's very sore. Okay.
Sore and sore.
Tore and sore. When then Thor's coming in next. Okay. All right. Now, you gotta have this. This is one, I know it's a disadvantage of it, but you make a mess when you use the ice cup versus a cold pack.
Exactly.
Because you get a little mess because the ice does melt.
Brad, we're gonna flip.
Okay, say no more.
You're sitting right here. Turn. Okay. That way we can see that elbow.
Yeah.
No, face this way somehow.
Bob, why Bob? You want this?
Yeah. How's that, Nancy? You got that? Okay. All right. So this is the tender spot here, and all you do is boom, and you start rubbing. A little tough to handle at first.
Actually, sometimes if it get a sore spot, some people really think it feels good right away, but other people it's like, yeah, sometimes it bites a little bit. And I always explain this to patients, you're going to feel the cold initially, and after about 1 to 2 minutes, it's going to start to kind of burn a little bit and be uncomfortable. You got to get through that spot.
Yeah, that's the tough spot.
By the time you get to 4 minutes, it's going to start to go numb, and the pain is going to be going away, and it's going to be feeling better. And I'd go 5 minutes. What do you do, Bob?
I usually go to the point where it's numb, and usually it's numb when you can take your fingers, and this feels like one finger instead of two fingers.
Oh, sure.
See, I'm hitting 2 fingers like this,
Yeah.
and right now it probably still feels like 2, doesn't it?
That's starting to get, yeah, it needs a little more.
I mean, you can go up to 5 minutes, but just if you're really in a hurry and you only have a couple minutes, a lot of times you can numb this up, in that small amount of time.
Sure.
And a lot of times you'll get that hyperthemia, where you get a redness
Right,
look.
yeah.
The
You'll
skin,
see the skin will
have
color.
change color.
Yeah.
And you might have to tear it off a little bit more because the ice as it starts to melt.
Yeah. It's kind of like those red marks when your cheeks blush.
Right.
So if you wanted to blush your cheeks, you could probably ice pack them.
There you go. You get a little rouge on your
There
cheeks.
you go. It'd be a little cheaper too.
All right, Brad, let's talk about some of the areas where we could use this.
Okay. Yeah.
Shoulder's good.
You bet.
I used it on my shoulder one time. This is a great one.
I use it on knees. A lot of my patients, if it's a knee, I like knees and ankles.
Hip bursitis, I would say.
Yeah,
Right
on the
on.
side, it depends
Yeah.
on the person. One thing, I usually don't use it on the back, but you could.
You'd have to have somebody do it for you.
Right,
To do it at the
yeah,
back.
yeah. See now, yeah, this is one of those things where I can easily do myself here,
Yeah.
or here, 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 but back here or back here, obviously, it's
Would
a
be a little
second
tougher.
person.
So,
Right,
all right, go out and give yourself a massage and
yeah, get that inflammation down.
because we can help just about fix anything, can't we, Brad?
Except for a broken heart, Bob.
Can't fix that damn broken heart.